This video is about Pulsus paradoxes and timestamps have been given in the description. Before discussing Pulsus paradoxes, the normal hemodynamics of heart should be understood. During inspiration, right ventricle gets overfilled, because of which the septum between right and left ventricle gets deflected towards left ventricle and left ventricle remains underfilled because of this condition. And if we follow Frank-Starling law, then the underfilling of ventricle will lead to less end diastolic volume, then less stretching of heart, then less contraction, and then less stroke volume. And this less stroke volume will cause less cardiac output, which will ultimately lead to a drop in systolic blood pressure. And this drop in systolic blood pressure is specific to inspiration, not expiration. And because of this inspiration or inspirative systolic blood pressure drop, there becomes a difference between the inspiratory and expiratory systolic blood pressure, which is normal until it remains less than 10 millimeter of mercury, and if it is greater than 10 millimeter of mercury, then it is called Pulsus paradoxus, which occurs in cardiac tamponade. When cardiac tamponade occurs, heart gets compressed and this compression results into too much deflection, meaning more than the normal deflection of the septum between left and right ventricle, and this more than the normal deflection of the septum causes extreme underfilling of the left ventricle. And if we can recall Frank-Starling law, this extreme underfilling will result into extreme drop in systolic blood pressure, which will be greater than 10 millimeter of mercury, which will be called Pulsus paradoxus. The term Pulsus paradoxus is not only common in cardiac tamponade patients, but it also occurs in COPD, chronic obstructive pulmonary diseases like asthma, or constrictive pericarditis, or pulmonary embolism, or in the conditions of severe hypovolemic shock. Thanks for listening.